So my name is Marta. I am a clinical psychologist. I actually spent nearly 20 years working in the NHS. And just so you're aware, I have worked in different oncology services. I worked at UCLH and I also worked at St. Thomas's, where I set up the TYA service, the Teenage Young Adult Service, that didn't exist until I set that up. So I have worked in oncology with children and young people of different ages, and some of what I'm sharing comes from my experience as well. And I will state that when you hear it, which is often just like the practical ideas, and most of it is evidence-based, and it's to do with thinking around cancer services, pediatric oncology services for children, and thinking about it as an empathic service, of which you are a huge part. And I know that Larsen's Pride sent me some like bullet points, and I hope I've covered them all. But of course, we'll have a Q&A later. So if I've missed anything, just annotate it or put it in the chat box, and I will answer at the end. Okay, so for me, a cancer diagnosis means often years of intervention, months of intervention, and continuous contact with you, the healthcare providers. And developing a good relationship with children and families is key and should be a top priority for all of you. Of course, the cancer treatment care, the medical care is a top priority. But if you don't engage families, and we'll talk about that in a second, if we don't engage them and build relationships of trust with them, and of course, the children and the young people, there are going to be times where we're really going to struggle. And that struggle might happen anyway, because over the course of cancer treatment, children and young people go through phases and stages. But it's going to be a bigger struggle if you're not a person that they trust or that they feel able to communicate with. And the emotional needs of children and their parents are for everyone. It's a whole team approach, because as a clinical psychologist, I often used to get called on the ward when a child was crying. So I haven't stated this on my slides, but I'm going to say it here and now, and I might repeat it. Crying is really healthy for parents and for children. It regulates their bodies. It does not mean that they're in a mental health crisis. It doesn't mean that they need to speak to a psychologist because there's tears. It does mean that you have to use an empathic approach. It does mean that in that moment, you're being called out to just be human with this family. And so I think that's really, really important, okay? We're not going to see distress as necessarily something for a psychologist to jump in. We're going to think about the environment, the context that surrounds children and young people, and the fact that these emotions are very likely very normal. And therefore, we can be human with them as well as a professional in that moment. And for me, physical care, psychological care go hand in hand. We know that psychology isn't in the mind, it's in the body, and it's in the relationships around us. So it's really important that we think about medical care alongside holistic care, which is the whole person. So, well begun is half done is one of my little mantras. So I'm sharing it here because I actually think this is really key. And for you, for most of you, you're all hugely experienced. I have no doubt. Some of this is going to feel like you know it, but I'm going to repeat it if it's repetition, because I think it's really important. And particularly with families you struggle with, okay? If you're already in relationship, in treatment with a child and their family, and you're having a struggle, I want you to go back to basics. Because sometimes when we work on these beginning steps, it resolves an issue, or it makes an issue easier to understand or to work around. So for me, where you see a child and family really matters. And I know that, space is sometimes really tight and we don't have dedicated clinical rooms or nice rooms the way we'd want to. That's not always possible. So I am not saying like find a lovely room with some nice candles and a lovely sofa. Let's be real, that's not going to happen. But how you set up the room does matter. And it doesn't have to take very long, because often time is, a luxury. It only needs a few minutes, if that. It means you being in the room first to look at it and to think, what do I need to make this more appropriate or more pleasant for this family? So for really little ones, expect to move around. Expect to give them some room, some space so that they can toddle about. Don't expect them to just sit in a chair and be still. That is really an inappropriate expectation for a small child. Have an area with some toys. So by area, I mean maybe you sit the chairs in a circle. Remember, how you set it up matters. What do you want to do? Do you want to be the expert in the middle? Would you like it as a circle? Or are you going to put the child-friendly or appropriate chairs? If you've got some little chairs that you can take from the playroom, bring them in, great. If not, where are you going to put this kid? Are you going to put them in the corner of the room? You're going to put them in the center, in between all of you, on a little, with some little toys in front so that they can be part of the conversation, but not have to talk if they don't want to. Pens, coloring paper are just easy essentials. And to the teams I've worked with, I've often just said to consultants, like, just buy yourself some Crayola and grab some paper from the printer and just carry your Crayola pens with you. They're not expensive, okay? But they should be part of your toolkit because we know that children engage and build rapport with adults better when they're doing rather than just sitting and talking, which is really not how young children operate. And this talk is for up to the age of 12. And for me, these are all young kids, okay? Even a 10 to 12-year-old will enjoy writing, doodling, just not having to have eye contact with you, okay? So it's about giving them permission to do something else. And always, I'm saying this in capital letters because I didn't want to forget saying it to you, but I don't want you to forget it either. Never forget that when you're having these conversations in a room with parents, a child is always listening. And I don't care how little they are listening. And sometimes they won't understand the words you're saying, but that can actually be frightening to little ones. So even when they're playing, even when they've got headphones on, if they come in with headphones, on an iPad, on a phone, because some families will bring their kids like that, doesn't mean they're not listening or absorbing things or paying attention, okay? Don't take lack of contact or lack of interaction with you as not listening. Really important. So try and keep your language positive. Of course, that's not always possible, but try as much as you can to think about children in the room rather than just talk about them. Okay, so things like, I really want to understand something. Oh, by the way, can I ask your mummy and daddy about whatever it is? Can I ask them how you've been doing last week? Is that okay? I know that you're drawing, but we're about to talk about you. Is it okay if we do that? Please involve children and young people in these conversations, even if they shrug, even if they grunt, even if they look really uninterested. It's really important. Okay, my part 2 of Well Begun is half done. This is about the first time you meet them, because I thought that would be important given one of the points that I received. For me, when you meet a family, but again, if you get stuck, I want you to come back to this beginning, okay? It's about getting to know them. It should be about engagement. It shouldn't just be about, this is the treatment plan. This is really important. And if you feel like you're stuck for time, it's not going to work, then please consider having more than one appointment. Okay, one is about getting to know you and one is about a treatment plan, because this is about engaging families and children in treatment that is going to be painful, that is going to be distressing, that's going to bring up loads of big feelings for them and may or may not cure, I'm doing it in quotes, the cancer. And you know that, the parents might know that, there is a lot of uncertainty going on, and it's really important that families feel like you see and you hear them, like they can trust you, because you're not just a medical professional, you are a person. And that's really important, especially when you hit a sticking point with a young person or a child. If you just jump in with medical information, the family and children, the way they see it is, you only see my cancer. And most of you will have a psychologist in your teams, hopefully. I know not all, but hopefully a little bit of psychology. And you may see that it's the psychologist's role to engage the family, to build that relationship. But you will be the people who will see this family more. You'll spend more time with them. You will probably interact with them more frequently. And therefore, the relationship they have with you should actually be stronger than the one they have with a psychologist. So see this as a starting point and think about, how do you want to be seen by this family? What is the level of safety, the level of trust that you want to build? Because that's going to guide you in how you're going to do this. Now, This doesn't have to take hours, just so we're clear. I did say you might need 2 appointments, but that just depends on your style, time, the medical bit. That is really key and important. I've just given you a couple of ideas of things that children and young people really value if you want to build rapport and engage them. So talk about their family, talk about their pets, talk about their interests, nursery, school. Really gauge an interest in these things. And also think about important events that they've experienced recently or across the year, or, like if we're thinking now, like I will talk about the beginning of the year, but also think about important events that are to come. And this is really important. Think about dates, months. What are these events? Because sometimes it is within that knowledge, that kind of information, where you will see sticking points. Kids might say, I'm really looking forward to some big party, or my birthday's in March and I'm so looking forward to because I'm going to go, I don't know, make pizza or something. God knows, something kids are really up for these days. And that March birthday is really key. And if you know medically in their treatment plan, that's going to be a time when they're going to be really sick or they're going to need lots of hospitalization, you need to know that. Because knowing that information is going to help you problem solve as a team, hopefully, but also think with this family about what the options are. And you can do this in advance. You can pre-plan rather than disappoint. It's a really important thing. And it seems so minor, but these are the things that teenagers and young kids really care about. Little things you can try, like in a first session, you're running out of time. You've had this conversation with me and you think, but I need to gauge these kids, but I don't have a lot of time. Right. Here's some ideas. Ask them if they're young. Sorry, I think somebody's mic is on and it's being recorded. So
there you go, hon.
I'm just pausing for a second. I'll just wait for Lyndon to mute all the mics. Thank you. Ask young children to draw something that's important to them, or draw me a picture that says something about you. That's a really nice way of asking. Older kids, ask them to draw. Of course, if you're arty, go for it. Otherwise, can you write 5 things you think I really need to know about you? I mean, one of those things might be, I don't like you, and they want to tell you that. That's fine, by the way. Take it in, okay? Take anything they give you. But holding this in a file at the beginning or in the front somewhere, with a little paper clip, something important, so that you can, and I know most of us use electronic files, but we'll have little paper folders still. I would really keep this. And every time you see this family at the beginning, bring it out. Ask kids if they want to add anything. Do they want to amend? Say to them, oh, I remember you said this last time. How is that going? Or I remember this was really important to you. Or I remember you said you didn't like me. On a scale of 1 to 10, how much did you dislike me last time? Oh, 10. Okay. So do we predict that today you're going to like me even less? Is it going to be 15? Is it going to be 15 out of 10? Or could it be a 9? What have I got to do to make it 9? So you like me a tiny little bit better. That might seem really silly, but that's actually a really big, important conversation to have with a kid. And if you scale it like that, like I just did impromptu out of the top of my head, you also engaging kids in a conversation. You are developing a relationship, even if it's about them not liking you. Okay, so we can use absolutely everything kids give us, but first we have to get them to give us something. Okay, therapeutic alliance problem solving. So for me, it's the things that you need to think about. Can you sometimes have a private space? Really important to think about how families might feel when others overhear the things that you're saying to them. So on a ward, for example, and sometimes there's no choice. You're going to have to do it. But even if you just take a moment before you go to talk to a family and say, how will they want me to share this information? How will it feel for them when other people around them can hear me say this? If you just do that, it's going to change. It's going to transform possibly the words you say and how you say them. or even asking for permission. I need to have a really serious conversation with you, but today we don't have another room. How do you feel about me talking about it here? Is it okay? If it's not okay, shall I give you a call? Shall I give you a clue about what we need to talk about? Mum, dad, child. We need to talk about X. Now, do you want me to carry on with this conversation? I know other people can hear us. That's respectful. It's really respectful. And again, kids, especially as they get older, really care about this. Pace yourself. I've said this already. Don't go into it again, but do pace yourself. Slow things down if you need to. Building a relationship is going to really support your treatment plan in the future. Children don't like to be told what to do. I mean, I would say adults don't like to be told what to do either. So make sure that you communicate in ways that show an interest in them so that you're asking for an opinion. Does that make sense what I just said? How do you feel that you need to do X, Y, and Z? How could we make this more pleasant for you? Because we know that you don't like this intervention, the blood test, the blah, blah, blah. We know you don't like this. So what is one thing that we could do to help you get through it, make it easier, make it more pleasant, make it more fun? Ask them, give kids credit because they often have really brilliant ideas. Sometimes they ask for things that aren't possible, but that's okay. That's our job to say, we can't do that, but thank you for telling me. Let me have a think about what is possible to get the thing that you're hoping for. Now, we all judge others. This is just a fact. So it's pointless trying not to judge other families, but instead, can you find your curiosity? Because there are going to be families that you find harder to relate to or harder to engage or harder to like. And that's just human. But if you start to notice that you don't really like talking to a family, that every time their name comes up, you're like, oh God, I dread this. That's really important. And can you talk about this within an MDT setting? Is it possible for you to get vulnerable and say, you know what? I struggle with this family. How are other people relating to them? Nurses, play therapists, whoever, psychologists, who else knows this family? And can you help me relate to them differently? Or can you help me find something really positive about them? Help each other, support each other. It's really important. Avoid reassuring children and families about symptoms or the date that they are going to get discharged. I have seen this happen so many times, and it's always with positive intentions, but it backfires because honesty is better than giving certainty if you don't have it. And often you won't. That's my experience with cancer care, that you have hopes the same way parents have hopes, but sometimes it doesn't work. So it's so much better to kind of say to a kid and a family, you have to come in, and we don't know how long this is going to take. We don't know how long you're going to have to stay in a hospital. We're hoping it's going to be a week, but we can't guarantee it. So I'm just going to check in every day and give you an update. And by Wednesday, Friday, whatever day it is, we'll do a big review and we will tell you whether we need to extend your stay or you can go home. But today I can't tell you how long it's going to be. So yeah, make sure you pack enough stuff. Make sure there's another parent or somebody bringing you extra clothes or swapping things around. Really important that you stay honest and you keep it really simple. And I do say this because it's true. Kids are not scared of the truth. Adults are often scared and we layer our emotions on information. Kids are often not scared of the word cancer because they don't know what it is, but adults are. Don't be afraid to use real language, correct language, and keep it simple and honest. Children value that. And if they get upset, that is okay. It doesn't mean you've done your job wrong, okay? Your job is not to make children happy. Your job is to get them through their cancer treatment. And give children options, choices, whenever is possible. And they might be really small things, like when are the best days or times? Can they come in an afternoon or are they coming in the morning? If they've got a party going on Thursday, God knows, or on the Saturday, instead of coming in on the Friday, can they come in on the Monday so they don't miss out on some kind of birthday party with their friends or something that they've been looking forward to for ages? Can we find that flexibility? Sometimes you can and sometimes you can't. But actually having that conversation where children feel like you're listening, you're paying attention to what matters to them can transform the struggle when you have to give them a treatment, an intervention, medication they don't want, because they're more likely to listen to you if you've always listened to them too. Okay, communication, because this is what we're talking about really. And getting communication right is not about getting it perfect. You're going to mess up sometimes, and that is absolutely okay. But it is about thinking about the fact that children are not mini adults. You need to think about developmentally appropriate language, and you need to not think of language just as words. So this is an exercise that I've done in a workshop before, and I would, if we were doing a different kind of workshop, I would be asking you, each of them independently, and getting you to speak up. I'm not going to do that. But I do want you to think about it and think about one of your families, one of your kids, right? Maybe think of a young one and an older one, if that's useful. Just start with one and imagine that they cannot hear you. So how would you greet them? What would you do that shows that you're friendly or approachable? They can't hear you. So forget talking. So I'm going to give you some clues, some hints. I mean, it's not difficult. This is not a test, okay? You should all know this. And you're all doing it anyway. The thing is, we will often forget some of these little things when we're talking to children because we're adults and our adult brains take over, right? So obviously, if a child can't hear you, okay, imagine you're behind a screen or something. They can see you, but they can't hear you. A way to greet them might be to smile and wave, right? I've just said hi to a kid without speaking. And yeah, I do want you to say hi to children like that. Obviously, probably not the 12-year-olds, but I do want you to smile and to think about your body and what it's doing. What is your body language doing? Because if we go, hi, it's very different to, hey, how you doing? Very different. And kids read body language. They are very attuned to how you make them feel. So this is really important. Another one. Because this is what I would have done in my workshop, right? So they can't hear you. What if they can't see you? So that means we got to work better with our vocal tone, with the words we use, because they can't see that we're being friendly. They can't see a smile. And this is about helping you think about every part of your communication with kids. And what if they can't see or hear you? So that might be about using touch, thinking about what else. How do you smell? I'm not even joking. Cancer treatment is really tough on all the senses. And I want you to think about the kind of senses that you're triggering in kids because it's important. Are you wearing something like I'm wearing something soft and cozy? And it might seem like nothing, but kids like it. If you look softer, they're like really harsh. It's really like small details, and over time they can have an impact. So I want you to think about all these things when you're communicating with kids, particularly on the ward, because it's good communication isn't just about good language. It's about how we show up and how we make kids feel and thinking about all our senses. It's really important. And then I've added this because it's important to just remember, don't assume that kids don't know anything, but also don't assume that they know tons. And I'm going to go into like developmental ages just to give you a bit more information on this. But, you know, children who experience illness, sickness, have been on the ward for a while, they tend to understand things much better than other kids their age. So don't patronize them, but also don't make full assumptions that they understand everything, okay? Keep curious, keep asking, and, you know, make sure that when you're communicating with them, it's making sense to them, not just their parents. Okay, so I've broken it down into 3 slides just to give you a sense of this, because I don't know how much information background you have on development, but between the ages of 2 and 5, children have no concept of time. So it's much better for you to focus on the here and now, today on the ward, or today in your clinic appointment, than discussing long-term care plans with really little kids. Their parents might need to know, yeah? But when we're focusing with them and with prioritizing information for children, we want to prioritize about what matters to them. So for example, you want to keep it simple, you want to keep it honest, okay? If they need a blood test, It's okay to say, you're going to have a blood test today. That's fine. But it is better if you say, the nurse you met before, I wrote this down, but I'm not going to try and read it, but the nurse you came before, who you met before, is going to come in a moment, and she's going to take you to have a blood test. And that blood test is going to help me understand what's going on in your body. And it will help me make sure that you get the medication your body needs. And your mummy and daddy, whoever it is going to be with you at all times. They're going to keep you really safe. And by the way, when you go in that special room for the blood test, can you have a look at the stickers on the wall? Because there's a blue fish. Can you find the blue fish for me? And if you find it, can you tell me who's next to it or where is it on the wall? Will you do that for me? Thank you. See you in a minute. Okay, what are we doing there? One, we're explaining what they need, very concrete, very specifically. This is for 2 to 5-year-olds. 2, we're going to offer them something positive to focus on. Now, most places I've worked in, when they go for a blood test, there's often stuff on the walls, sometimes on the ceiling. I want you to go into that room and just find 1 or 2 things that you can recall in your brain are there and make kids try and spot them. Now, of course, if this is a kid who's come and had tons and tons and tons of blood tests, you might have to go back in that room and find different stuff. Or even I've had medical doctors put like a little key ring before and said, now there's a little teddy key ring in that room. I've hidden it somewhere. Can you tell me where it is? And they just leave it in one spot, but then they move it around. It's a tiny little thing, but it's going to make that child think of you positively. And it's going to help that kid feel distracted for a moment in a room when they're about to have something invasive. That is going to hurt. Blood tests hurt. So let's not kid kids about this. It's not going to hurt. It is going to hurt. Don't lie. But it's okay to try and make it something positive, help their mind distract from this. And of course, it'll make you a positive influence. 6 to 8-year-olds. Now, they understand time a little bit better, and they can also understand simple biological facts. For example, they know that they've got blood. They've often, cut themselves. They know blood comes out. They know it hurts, all that kind of stuff. But they're still very concrete in their thinking, which means that they don't always understand what's inside their bodies in terms of organs. So we still want to keep things really simple. We want to make sure we put it in terms that they will understand. So talking about cancer is such a big thing that, at this age, it's going to feel really confusing. So this is made up, and you do not have to use this language, just so we're clear. I've made this a bit flowery, and you can make it much less flowery, okay? But it's about saying your body's making too many blood cells of a kind that isn't great for your body. Something like that. It's a bit like weeds growing in a really nice garden. And we want to get rid of these weeds. So I need to find some medication for you that will get rid of the weeds, but keep your garden looking really nice. The rest of your body is going to carry on looking nice. Something like that. They also have cartoons and comic strips. And if you've never seen one, I definitely encourage to go and have a little look to inform yourself, but also because you can direct families to it. So Macmillan's got some, Click Sargent, the Teenage Cancer Trust, and MediKids has little videos online. And I always say, go and have a look. Don't just direct families to stuff. If you haven't seen it, you don't know if you like it. You don't know if it's good. So go and have a look, watch some little videos, and then you can help parents think about having this conversation with their kids further at home by looking at this video. Some of these videos are a couple of minutes. If you've got the time, you're inclined to, you could put it on. You could put one of these videos on in your clinic, on your laptop, show the kids, because loads of these websites will be accessible, even if you work in the NHS, and show them and then talk about it together. Just ideas about how to communicate about these big topics. As kids get older, kids obviously have concept of time, they understand bodies much better. But the thing that I want you to hold on to about this age group is that they can see straight through you. So don't try and be cool. Don't try and kid speak to them. Be yourself. They will really value genuine conversation from an adult. Describe what's going to happen in terms of what you know. Don't make up stuff that you don't. It's okay if you don't know. It's okay if it's uncertain. Just tell them, we don't know. We're going to have to keep talking together because I'm not sure about X, or I don't know how much time Y will take. Just be honest with them. They value that more than anything else. And definitely think about when struggles happen, when plans change. Try and make this kind of as honest as possible, because treatment plans sometimes fluctuate, and that is just the nature of things. But you might need to make things, or you can make things a little bit easier by, I kind of gave that example earlier, but instead of saying to kids that it's going to take 5 days, maybe tell them that you don't know. And you're going to have to go day by day and see how their body responds and see what else they need to do. But that you will keep them updated as the progress happens. And that the minimum stay is however many days. And then we will just review. And you're really sorry. That's awful. It means they can't make a plan. It means they don't know when they can go back to school. It means lots of things. And it's okay to empathize over that. Okay, because this is really hard for them. And it's okay to just be really honest rather than say you're coming for a week, but then on Thursday you change it and say, no, you're staying for 2. Because that disappointment sticks to kids and their parents like really heavy. And sometimes just avoiding that disappointment makes things smoother. Yes, and do talk to older children about the common side effects of the treatments that they're having. Don't be scared about being honest. Don't be scared about a kid showing their emotions to you. Think of it as an opportunity. If they cry, if they get upset, think of it as, this is great that you're letting me know that this is going to be really tough for you. Because now that I know it's going to be tough, it helps me start to think about ways that we might be able to help you cope with this, or people you might be able to talk to that can support you through this, or other young people's stories that have been through a similar thing as you. And maybe it would help if you knew what helped them get through this. When we use these things as opportunities rather than, oh, no, I can't make a kid upset, it opens up conversation, it opens up possibilities, and it builds trust. Now, emotional responses to treatment, I'm just looking at the time. I knew this would take me over, but I'm going to carry on. So I'm talking about parental responses as well as child responses, and I'm also going to talk about you because you are key to all of this. So parental anxiety, we know, influences the psychological health of children. So learning to address parental anxiety is really important. And things that parents might experience that I'm sure you've experienced before, the denial of the symptoms or the illness, stress, having a really acute stress reaction, the parent who constantly calls the nurses like 5 times a day, every single day of the week. Specific procedural anxiety. Yes, parents have this too. I have witnessed parents fainting whilst their children have a blood test. We need to be aware of this because we could mitigate that. We could definitely stop that from happening and causing greater distress to a small child who is now terribly worried about their parent if we knew, right? If we can have these conversations early on and make a plan about what is the parental support that is needed, we could avoid some of these things. And of course, big emotions like anger. And whilst you might be thinking about the course of treatment, and I hate that I've called you HCPs, by the way, but I wasn't sure he would be here. So sorry for generalizing all of you into like this box, which you are not. But when we're thinking about treatment or medical care or, you know, the blood test or, you know, if you're a play therapist, the kind of the things that you're going to support a child or family get through that is really tricky. Whilst that's happening, parents are thinking, is my child going to die? I've been kind here, but what they're thinking is, are they going to die? We know that that's at the forefront of the mind all the time. No matter what you say, by the way, they will be thinking about this. When are they going to go back to school? When are they going to just be a kid? And even if it goes away, even if the cancer disappears, are they going to have a normal life after all of this? Will they be normal? Will they be damaged? That is the question I get all the time. Is my child damaged for life? We need to be aware of these questions because they shape the responses and the reactions that you see in parents. And you also need to know, which I'm sure you do, that uncertainty is a really difficult thing for adult parents to hold. Certainty gives them like something to hold on to. But if you say we don't know, then they're like, well, if you don't know, what do I do? Right? It's really tricky for them. And also their emotional reactions are going to be shaped by stories of cancer, whether they've experienced it, a family member's experienced it. That show they watched and it had cancer in it and it was horrendous and it's really upset them. And now it's the only thing they can see. Cultural understandings of illness and cancer, different cultures, different faiths see this in a very different way, and it can add complexity. And if you don't know what a family background or culture thinks about this or understands about it, you might land in a challenge later on in the treatment journey that like takes you by surprise. Things like work and finances and family support. So this is really important because for some people, the greatest impact of cancer is that one of the parents might have to not work for a while, or the family support they receive is from a grandparent who was abusive to them in the past when they were children, but now they need their help. And this is absolutely transforming in a negative way their family atmosphere. And that is the biggest impact. So don't assume you know the impact without having these conversations and holding some of this in your mind. And no, you're not going to do this in a first conversation. This is why those first slides are about engagement, building rapport, building communication, conversation, and then developing a picture of this family. Because all this information is going to help you and guide you, and also think, what support do these parents need? Does this family need? And they're all individual and unique. They don't, most of them will need very different things from each other, even if they're going through the same treatment. In children, the thing you're most likely to see is anxiety or low mood. I've made it really simple for you because they are the main ones. And yes, of course, you'll see anger and you'll see denial. You'll see all of that. But for me, the things that I've seen the most are anxiety and low mood. And we know that treatment disrupts their normal routine, but it also disrupts a developmental trajectory for children because their routine is different, because they're medicalized. They lose developmental milestones that they would normally go through, which are often around socialization with their peers, which are often around independence. They often are slightly less independent, and more dependent on their parents because they've been hospitalized for a long time, because they've gone through cancer treatment. They often appear younger emotionally than children their own age. And this is really important to know. Anxiety is to be expected during the course of treatment. Some kids are really good initially, and then the more needles they have, the worse they get. Some kids are terrible at the beginning, and then they desensitize. How it's going to go is so individual. I can't tell you. You need to kind of work with it. But what does anxiety look like? It doesn't look the same for every child. And just in case, I thought it'd be useful to list it. So it can look like a panic attack, can look like outward fear, screaming, shouting, no, I don't. It can look like headaches and tummy aches and pains around their body. And sometimes that will be their illness. And sometimes it'll just be anxiety. And differentiating it will make a big difference. Things like avoidance. They don't want eye contact. They don't look at you. They withdraw completely from everybody in the team or on the ward. They look hyper. They're jumping all over the place. Okay, they're so busy all the time. That can also be a sign of anxiety, right? That hyperactivity. And they may change their appetite, which is also important. Like nourishment is really key. So thinking about how are they eating? What are they eating? Are they like suddenly unable to eat because anxiety's turned into a ball in their stomach? Really key. Listen to their worries, listen to the fears. Don't dismiss these clues if you see them that I've just listed. If you start to see the picture of anxiety, don't dismiss it and don't worry. Talking about anxiety will never make it worse. Some people are really scared of even saying the word anxiety or fear. Talk about it. Open it all up, because if you don't, it's not going to go away. And young children are often worried about things that are not adult things. They're sad that their friends didn't invite them to the cinema. They're anxious that they're not seeing their pet and Maybe they don't think their doggy's getting enough walks. I've seen so many kids who are really worried about their dogs, and the doctors think they're really worried about their medical treatment. It seems like sometimes it seems small and unimportant. But in a kid's world, when you actually think about what a kid's world looks like, their pet might be like the most important being. So it's really important that we understand this and then we can problem solve. So there are therapy pets in lots of hospitals. There might be ways that the dog could come and visit by staying outside and the kid going outside and meeting the dog. There's so many things. They could do videos of the dog. I don't know. There are so many options, but if we don't know the problem, then we can't find the right solution. And it doesn't have to be a complicated one, but we need to understand it first. And finally, I'm sure you know this, the medical ones around you, but I think it's important. And maybe also sharing this with families is important. So in my work, I've learned that steroids can contribute to mood symptoms. And also, oh, no, I'm not going to remember, but some other kind of medical treatments can also impact on mood or make kids look really, really manic and hyper. So think about reviewing medication, think about psychological support alongside, and think about the environment. And those things are all intertwined. I often see steroids blamed for everything, and sometimes that's not the case. They have an impact, but think about the bio, psycho, and social impact around a family and a child. I've done that one twice. And this one is important in terms of, because I was saying about if a child starts to feel in the room with you, you don't need to pick up the phone and call out a psychologist or a psychiatrist. Actually, just let children express their emotions as much as you can, because this is where resilience is born. Resilience is not getting through hardship and just looking tough. Resilience is feeling scared, for example, about having a blood test, crying, saying, I don't want it, freaking out, getting some support to calm down, giving their arm out while screaming and crying and being cuddled by a parent and still getting through a blood test. That is resilience. Did they get through it? Yes. Did they have lots of feelings while they went through it? Yes. That doesn't mean they weren't resilient. They did it. Resilience is not about, things that come easy. If it comes easy, it's not resilience. Okay, so that's what I want you to remember when we think about kids being resilient. And I want you to acknowledge that when you see a child crying or being upset about something, it's about saying it's okay that you're sad or it's okay that you're scared. I get it. Like empathize. Please empathize with kids. This experience is terrifying for them. Even the little blood test that seems like nothing, maybe to an adult, it's a big deal. Listen to them about their worries. Don't try and fix and rescue. Just listen. Just, show that you can empathize with a kid and see their view of the world, which isn't ours. And then ask them, how can I support you through this? Or, who in the team might be a good person for you to talk to or to play with or to do something nice with? And encourage kids to come up with their own solutions, because that's really important. Just so you know, I shared this exact same slide to the parents because it's really important that all of us, all the adults around kids, think about resilience and build resilience. And it's important that we allow kids to find solutions. Of course, if they can't find one, we're not just going to leave them, okay? We're going to offer some ideas. And finally, taking care of you. I say finally, but really, this could have come right in the beginning because I think it's so key. So for me, one of the things I learned as a professional in pediatric oncology is that there is this strong belief of we can't let kids die. And talking about this is really hard. So I'm not going to go into loads of this, but I think it's important to note that you can't save all kids. And I know that that's one of the hardest bits of your job, 100%, because I've experienced it too. But knowing that as a team and as an individual, you're going to go through similar emotions as the parents can again build compassion, build empathy, denial, anger, shame, sadness, frustration. You're going to feel all those things at some point, either with all or some of your families. And the parents are feeling that too. And that's important, okay? You're actually going through kind of parallel experiences over the journey of a cancer treatment. And I know that burnout is rife in oncology teams, and you know all of this, but I'm just going to name it. You know, the exposure to child sickness and the potential of death is really heavy. Increased workload, which is true of all teams I've ever worked with in the NHS and particularly at the moment. Your increased workload with restricted and less resources, the inadequate support that some of you might experience from managers about having a break or going on holiday or needing emotional support for you. I get it. It's really tough. And if you're experiencing poor working relationships within you as a team, which can happen because big teams, oncology often has quite big team. Big teams often have friction. And to me, conflict could be a really positive thing. So I'm one of those people who thinks if you manage conflict well, it builds intimacy. It builds strength in relationships. But if you don't handle conflict well, it creates ruptures in teams. And that's not healthy when you're all working together as a family. So here are some ideas. And I've worded these very specifically, but I want you to think about taking regular breaks. And I know that's really hard. And you probably eat your lunch in an MDT because that's what I used to do, or in front of your laptop. But try, even if it's 5 minutes, just go for a longer walk round before you make a coffee. Just go for a walk outside your building. Just take a 5-minute break where you sit outside. Even in the cold, it's good for you. It's good for you. But I want you to look after yourself because burnout is like a killer of oncology teams and it will affect children and their families the most. Because if you're burnt out, you're not giving your best to them and they feel it. And so they're not going to respond in positive ways to you either. This is like, this really negative cycle. And I want you to think about what's going to help you as a team come together and problem solve issues. And if you need to, do call out for psychology, or if you've got counselors around who input into your teams, ask for could you have mediation? Could you have some kind of weekly sit down? Or a weekly kind of problem solving meeting. So staff support doesn't work. So as a psychologist, when we've called it staff support, nobody comes. Nobody comes. But if I say we're going to troubleshoot some challenges that we experience on the ward or you guys experience on the ward, oh, it gets busy. And if I bring biscuits, it gets even busier because everybody wants to dip in and eat a little biscuit. Make it short, make it friendly, but do ask because you've all got so much experience and expertise and you can share and build things together. Like I said before, when you don't like kids, you've got all the solutions within your team. There will be somebody who goes, I like that kid. That kid's lovely. And they'll tell you something you didn't know. But that won't happen if you're not coming together in these kind of moments which are separate to an MDT. Okay, we're not going through a list. We're not looking at the ward rounds or the treatments. We're actually just meeting together to think about the stuff that's hard. And outside of work, it feels like an important reminder. And yeah, I've made it in capital letters. So hold on to this, okay? I want you to live. Please live. Don't just go home and shut down. I want you to laugh. Find things that make you laugh. Laughter is so healthy and it's so important when you have a job like this. Make sure that you move. I didn't say exercise, I said move. Do a little dance, do a stretch. Actually try and stretch at work. It's really good for your body. Really simple stretches. Don't have to be time consuming, but it can totally change the energy in your body and actually your posture. So do that. Eat, please eat. Please don't forget to eat or drink. I should put drink water because it's really important. And take your holidays. Don't not take holidays. Please don't do that. I've met so many colleagues who won't do it. You have to do it. You have to care for yourself. Your well-being is key if you're going to continue looking after children and families the way that you do. And finally, I think this is my last one. Oh no, one more, but this one's nice. Hopefully they're all nice, but my last one is slightly different. I want you to think about how you celebrate small and big victories with the children and the families you work with. Think about this. Seems small, but we need to build hope with these families, okay? Even when there feels like there isn't what any. So, think at the end of a hospital stay, can you make them a card with some stickers? Get your play specialist, your play therapist to help with this. It's great and it's fun and it's positive. But also, if you're a medical consultant, please get engaged in this because it's fun. And a lot of what you do is not. And I'm not joking, but 5 minutes doing something nice will make you feel good too. Okay? Take photos of all of you making a silly face and give it to them in a card and see, see you next month. It's a small thing, but it's sweet. And kids like this. Okay, things like accessing special days, whether it's through Starlight or the Teen Cancer Trust or anything that's out there for them. Think about it, encourage it, offer it. It's just like that little sprinkling of something nice and motivation for the future too, for lots of these little kids. Ask them how they're going to celebrate finishing their treatment. And by treatment, I don't mean the end of cancer care, just so we're clear. I mean like a week of treatment. Why? Because it's good to not just focus on the medical stuff. It's good to say to kids, but you should do something nice. What are you going to do? Even if they're exhausted, they're going to be in bed, they're going to be like drained, but they could still do something nice. What would that look like to them? And I don't know what it is. It could be something like, I'm allowed to play on the iPad and I'm never allowed. I mean, I know that's rare, but that would be my kid. Or I'm going to watch, my parents have said that we can buy this film because we can't go to the cinema, but I can watch it at TV and I'm going to watch it with my favorite ice cream. Whatever. Ask them. Make sure that what you're doing is kind of punctuating these moments as important rather than, yeah, we'll see you in a month's time. And as a team, think carefully about how you celebrate kids in the ways that I've just shared with you in front of other children. I have met so many other kids who see celebrations and then they say, well, that's never going to be me, or I'll never have that. And often it's because we celebrate the end of a cancer treatment. But I'm asking you to celebrate all the tiny little milestones. Celebrate the blood tests. Celebrate all of it because kids are having such a tough time. Why not bring them a little sprinkling of joy? It doesn't have to cost a lot at all. Like even just having the conversation can be so meaningful to a kid who's probably not thought about doing anything. And it can really build a lot of positivity to them. And my last one, this is something I shared with parents, so I thought I would share it with you. Obviously, you'll know about all the charities. And I told parents about this too. But these are three of my favorite books that are not specific to cancer, but they are because they open up conversations around. So Pip and Egg, I would say it's around friendship and leaving. So lots of kids become friends on the ward, and then one of them will leave. And you might need something to help them think about this and talk about it before that day comes. And they might leave because they get better, or they might leave because they die. We know this, but it's important because this does happen sometimes. So we want to think about that. Okay, and Pip and Egg is a beautiful story. Like it's really pretty. It's lovely. The Boy with Flowers in His Hair is probably the most cancer-ish book, but it's not really about cancer. And it's beautiful. And I think it will open up lots of conversations around loss, around support, around difference. And these are things that I think looking at reading for yourselves is great. But also if you want to have them in your clinic, go for it. You know, what a nice thing to do to offer them something that may open up conversation when and if you need to. And My Pet Star is about a star who falls down and is bruised and really hurt. And a little, I don't know if it's a girl or a boy because they've left it very neutral and I kind of love that. A child who tends to the star. And then the star gets better and shines brightly in the sky. Now, for some people, that might sound like a story about death and illness. For others, it's about care. It might be about all of you as a team. And you're looking after lots of pet stars and making them shine brightly one day. That's the hope. So anyway, I thought I'd share those resources with you because they're some of my favorites. And I think books can be really powerful ways of opening up deep conversations. And that's the end. You can find me on Instagram. I've also written a book, and I have also done some research in oncology, and you can probably find that now. I can't even remember what peer review journal it's in, but it is somewhere. It's in my website. You've got all my journal articles in there. But that's it. That's the end of my presentation, which has overrun. But I'm happy to do a little bit of a Q&A if